Now, it has been called a world first. Surgeons have carried out multiple caesarean sections and ovary removal operations at the same time. And these operations were on women at high risk of developing cancer. And all this means they won't have to undergo further surgery later in life to remove their ovaries. And it could even have saved their lives. Well, joining us now is Claire Rodrigues Lee, who is one of those women who underwent the procedure. Yes. Thank you very much for being with us.
Thank you.
And also Professor Adam Rosenthal, who did the business. Is that the right way to say it? Can I ask you, this might be an ignorant question, because this is the only way to prevent the risk of cancer for some people like Claire. Why wasn't it done before, and how did it come about?
Well, it's quite interesting actually. We've been doing this kind of surgery, not at the time of caesarean section, for a long time now. But we had a patient approach us out of the blue and say, I'm pregnant, I've got a gene that increases my risk of ovarian cancer, I know I'm having a caesarean section for my baby, could you take my tubes and ovaries out at the same time? So we all
came from a patient.
It all came from a patient's suggestion, absolutely. Yeah, patients know best.
Yeah, we often hear that, don't we? But there's the proof. And for somebody like yourself, Claire, in that situation, it's an amazing ability to do those operations together, but it's also a lot for you to think about and process, isn't it? Big decisions.
It is, but for me, to have the opportunity to be able to do it at the same time was a better decision than having to do it separately. So I knew I was going to have my ovaries removed because of the high cancer risk, but it just meant that I could heal at the same time as having my C-section, and I didn't have to leave my children to then go back into hospital to have an oophorectomy, which is removal of the ovaries at a later date.
Yeah, and I wonder there'll be people watching this now who might be in the same situation that you were in. What sort of things would you advise them to think about? Because there's a lot to consider.
It is a lot to consider, and everybody has to make choices that's right for them. I would just say look at the risk in your family. Obviously, if you are a carrier of BRCA1 or BRCA2 and you have completed your family and you're perhaps having your last child and you are thinking about having your ovaries removed, then it just for me, it would make sense to do it at the same time, because I've had a C-section done separately with my first child and the healing process is no longer or no worse than having the double surgery.
Okay, and Professor, how much is age a consideration in making the sort of decision that Claire's made?
It's critical because it depends what gene alteration you have can affect the age at which we recommend having the surgery, and that's because the risk of cancer increases at different ages depending on which gene alteration you have. So we have to take that into account when we're planning these operations.
And is it the case that people like Claire can now go and ask for that? How sort of commonplace might this be going forward?
Well, we hope that by the publicity that your programme, amongst others, is thankfully giving us, that this will be something that women start pushing for. And I don't see any reason why most hospitals couldn't potentially offer this surgery.
And Claire, how are you doing and how were you doing afterwards? Did it take longer to recover from the double operation, if you like?
It was the recovery was no worse than having the C-section on its own. And I just got so much relief from knowing it was done, and I could get on with my life. I didn't have to have this shadow of doubt over me anymore, worrying, am I going to get ovarian cancer? So it was definitely
the right decision for you.
It was absolutely the right decision, definitely.
And we mentioned right at the start, Professor, that it's a world first, and you don't know of any other time that this has been done.
We've not heard of this being done. We've not seen it published in the medical literature. It may have been done before, but as far as we know, this is the first time it's been reported, at least.
Well, it's great to have you on the programme. Thank you so much. Great to see you looking so well, Claire, as well.
Thank you so much.
And Professor, nice to talk to you too.
Pleasure.
Thank you.